Hello, I'm Alan Spear, and I'm a cardiothoracic surgeon. I've been performing heart surgery at Inova for more than 25 years. One of my particular areas of interest, and the one about which I am pleased to talk to you now, is the surgical management of aortic valve disease. The aortic valve is one of the 4 valves in your heart that act as gates to move blood through your heart into the lungs and back out to the body. The aortic valve is composed of 3 leaflets that open and close. When open, blood passes from the left ventricle, the major pumping chamber, out into the body through the aorta. When closed, the leaflets prevent blood from returning back from the aorta into the left ventricle. The aortic valve connects with the aorta, the major blood vessel that supplies blood throughout the body. Sometimes the aortic valve becomes diseased and requires repair or replacement. When that is necessary, you will need to see a cardiac surgeon. While disease of the aortic valve can be caused by many things, the main conditions are aortic stenosis and aortic regurgitation or insufficiency. Aortic stenosis occurs when the valve becomes stiff and can no longer open all the way. This means that the proper amount of blood cannot flow through the valve to the heart. Aortic stenosis can occur in 3 different ways. First, a person can be born with an abnormal valve, which then can become calcified as people age, particularly in their 50s and 60s. Second, if a person has rheumatic fever, the disease can damage the heart, particularly the valves. It then leaves the aortic valve that doesn't function properly because one or more of the leaflets in the aortic valve have become too thick. Finally, aortic stenosis can be a degenerative problem. Most often seen in people in their 70s, this is basically wear and tear for the valve, which then becomes problematic. Aortic regurgitation or insufficiency occurs when the valve does not close properly, causing it to leak back into the heart. Aortic regurgitation occurs in 4 different ways. Like aortic stenosis, it can be caused by rheumatic disease and cause the valve to not fit together properly when they close, thus leaking back into the heart. If a patient has aortoannulectasia or enlargement of the housing of the valve, then the root of the aortic valve is enlarged, which pulls the leaflets apart so they can't close normally and causing leak back into the heart. The third type of regurgitation is caused by infection of the valves called endocarditis. This is when certain types of infection, perhaps elsewhere in the body, spread to the heart valves, causing them to fail and subsequently leak. Finally, regurgitation can be a congenital problem, one that a patient is born with. And then, as the person ages, the valves become more diseased and leak back into the heart.